Resume the recording. So thank you so much, everybody, for attending. We are very excited of being resuming our webinar series. We had already had four episodes on the series, and you can check all of them in our website. I'm sharing here so you can see that you're going to be seeing all the previous editions of the series. We are very happy to be expanding this webinar to start connecting what we have been doing at SHEM as a group who has been developed a particular approach to the two biggest crises of our time, the the growing of inequality and simultaneously the ecological crisis. And we are now excited to receive today Dr. Tadhg O'Mahony, who has been defining a little bit the way we understand progress and asking questions and important ones about how we measured progress and how we can somehow reshape and rethink a little bit of the way that we are understanding this in the global scale, with taking in account not only canonical measurements like GDP, but diversifying and being mindful of the side effects. This is how I'm calling them, of the way that we measure stuff. Uh, this kind of activity and its consequences for the current generation and the next one, which is something that Sham is very aware of. One, I will extend my words to you, the floor to you as the host of the series, so you can move on with the presentations of today. I will stop sharing.
Thank you, Andre. You see me and you hear me well.
Yes.
Great. Welcome, Tag. We're really grateful you are here. Thank you always, Andre, for your facilitation of the webinars. Let me tell the audience who is hearing us now and those who will hear us once recorded that, as Andre said, this is a series of webinars that forms like the skeleton of what we call in SHEM, the Sustainable Health Equity Movement, the working group on ethics and metrics of equity. What we have been showing in the last webinars, to summarize in 2-3 minutes, was first we started with new UN population division data of the demographics of the world, which have been updated in great detail, and the trends and the estimates for the rest of the century. With those data and those related to carbon emissions and the scientific evidence of the correlation between cumulative emissions and global warming, we estimated something we call the ethical threshold of carbon emissions per capita in the world, something that very few people are aware of. But if we all acted, worked, moved around, heated ourselves or cooled in summer, or used the energy in a way that we would not trespass that ethical threshold, the world could probably be free from the point of no return of global warming, which is probably the most how can I say, the most urgent burning ethical dilemma that humanity has ever had. So we started from there, which is that ethical threshold, which it was in the region of 1.4 metric tons of CO2 per person and year. This is something almost unachievable by, for instance, any European citizen, just by living in Europe and having all the basic running of our countries, despite our how can I say, how ecological you want your lifestyle to be, is almost impossible to be emitting less carbon emissions than what the ethical threshold told us by this analysis. We did that with the Planetary Health Alliance, and that was the kickoff webinar. Then we looked at other ecological footprints and other metrics that define which countries are living respecting planetary boundaries. We did that with the with the ecological footprint network, and with others that have been looking at planetary boundaries, the Resilience Institute, and that selected a number of countries that are sustainable models for the world, which again rules out practically all the high-income countries. With that in mind, then we looked at which of those countries in the third webinar were having levels of well-being measured by life expectancy, which were above the world average, and that could lead us to the identification of what WHO agreed in its constitution in 1947, which is to aim at the best feasible level of health for everyone. So we looked at which countries were sustainable, were using also resources below the world average, economic and ecological resources. They were therefore replicable and feasible, and yet they were having levels of well-being above the world average. And we looked at those countries over time. That was the third webinar, to understand the reference models of well-being and sustainable equity. And the fourth one, the last webinar we had before the end of last year, was with, well, by the way, the previous one we did it with a very interesting set of economists and development scholars. And the last seminar, we looking with the lenses of the reference models, and then therefore being able to measure which is the excess mortality from by age group, by year, by country, by sex, which is the excess mortality, that is the price of injustice, the price of inequity above those reference models. And we looked at the geography of injustice with Professor Sir Michael Mammoth, whom you know was the chair of the Commission on Social Determinants of Health, and he directs the Institute of Health Equity in the University College London. So that's what we did. Each of those webinars backed by an article, by an analysis, and we had the participation of very interesting and leading scholars on the subject. That's why we are really grateful, Tad, that you're here today, because we read your papers and we read your studies, and we think, and we had a talk, isn't it? And we think we had a lot of synergy of ideas. What if you can, Andre, pass the slides I wanted to show. I'll try to go through them quickly so we have a good time for debate. But what I wanted to say, and bear with me, I'm looking at the mobile phone because my computer is on strike.
Are you seeing, Juan? Sorry, are you seeing your slides?
I'm okay. I am okay. So what I'm going to tell you is I'm going to do a summary of the paper I prepared for this seminar, which is called "Enough is Enough." You know, this is a saying of Gandhi, who said, "Enough is enough and more is too much," and how it is important to remind ourselves of a certain threshold above which the accumulation of wealth or income or power even is detrimental to health equity, and it prevents the universality of the right to health. I'll try to explain that in greater detail. Next one. So I quote this very often. This is written in 2,400 years ago, almost, by Plato in his Book of Laws. And he said the form of law which I should propose would be as follows. In a state desirous of being saved from the greatest of all plagues, here should exist among its citizens, neither extreme poverty nor again excess of wealth. For both are productive of both these evils. Now the legislators should determine what is to be the limit of poverty or wealth. So that's 2,400 years ago. The problem is capitalism, the mainstream economic system in the world, has never set a threshold of wealth above which we should really consider whether that is detrimental to the rest. Yes, poverty has been somehow defined by the World Bank and so on, but at levels that are far from compatible from what I said earlier, that best feasible level of health, which is the common global health objective. Next one. So I wanted to explore the link between GDP per capita. It's a very controversial measure, but it does measure the capacity to earn, spend, and trade goods with health equity and environmental sustainability. And I will end this presentation by presenting to you the thresholds that define the equity curve, which is compatible with health equity, those of dignity, excess, and hoarding thresholds. Next one. So there is something we call the dignity threshold, which is the minimum GDP per capita required for optimal health. This, as I told you earlier, we have been defining countries that have a good level of well-being above the world average, yet respect planetary boundaries and do it with feasible means, not above the world average, so they are replicable for all. The GDP, the average GDP per capita of those countries, in this moment there's only one country meeting all those conditions, is the threshold below which no country, and we have studies of 60 years, has been able to enjoy that feasible level of health. So that's why we call it the dignity threshold. These are country averages. So when we look at subnational data, we are even more sensitive in finding dignity thresholds which are of lower level, but yet they translate in good and even better levels of health. Next one. On the other side is the excess threshold. What do we mean by excess threshold? That is the GDP per capita level beyond which, above which, human well-being and life expectancy no longer improves. This is really important. There's a level of income, there's a level of wealth, and there's a level of GDP per capita, which, as it's mentioned there, above which more growth, more income, more productivity, more trade, more accumulation does not render well-being. We call it the excess threshold. We looked at subnational data, for instance. As you know, Japan, for instance, is the country with the large country, above 5 million inhabitants, that has the highest life expectancy both in men and women for the last 30 years. Would that mean that the GDP per capita of Japan is the excess threshold? Yes, at country level, but we look at subnational entities, and there is a preceptor in Japan called Nara with a GDP per capita which is less than half the average of Japan, yet it is in the top level of well-being and life expectancy. So, as I said, we can look for very good examples of the best possible levels of well-being and life expectancy, above which we are just harming, as you will see, the planet and preventing others from having enough, and yet not improving our own well-being. We call it the excess threshold. Next one. There is something even more telling, which is the hoarding threshold. What do we mean by that? If we start looking at the countries with highest GDP per capita or income and wealth, and we kind of level them off to the next one. So, for instance, the one with the highest GDP per capita is Luxembourg, and it's followed by Switzerland, I think I recall. So let's have in Luxembourg, let's cut off that GDP differential from the next one, Switzerland. Let's put them theoretically at that level. And you continue to level off those excess GDP from the highest levels of GDP per capita, the wealthiest countries. It comes a point when that excess GDP meets what we call the GDP deficit, which is what would be the GDP required for the countries, which is, in fact, they're half the population in the world, the countries that live with GDP per capita below the dignity threshold. We call it the hoarding threshold, and as it's defined, is the GDP per capita above which global redistribution of that excess could eliminate health inequities and environmental degradation. At least it could enable, at this moment, half the population by redistribution. Our next webinar will be with a tax and justice network on redistribution, equitable redistribution. it could meet that deficit and enable everyone to have the universal right to health. Next one. So these are now just a few graphs to illustrate these concepts. This is the evolution of GDP per capita and CO2 emissions. As you see, GDP per capita and CO2 emissions have been growing, and the threshold, which is the gray line, has been decreasing because we are gradually having a lower decreasing carbon budget and an increasing population. Next one. So we are really diverting from the ethical threshold. This is the correlation between GDP per capita and CO2 emissions, which there's a very clear correlation. The higher GDP per capita, the higher CO2 emissions. And as I said, there's a certain level, even below the excess threshold, above which no country has been able to respect the dignity threshold. Those, for instance, in yellow are some of the oil-producing countries that have even greater carbon emissions than what the GDP per capita would predict. Next one. And these are the countries that are below the dignity threshold, countries that are disabled from the universal right to health and from the health equity goals. You see the bubbles are in proportion to the population. The largest one is India. There's some others. And this is these are the countries that are that have no levels of well-being below that feasible level for all. Next one. And this is the next one shows the geographical distribution of those countries deprived from the right to health because of global economic injustice. They're basically in sub-Saharan Africa, as you can see, still in India, Pakistan, some countries in Southeast Asia, even some countries in Europe, for instance, Ukraine, and some others in North Africa, and then a few countries in Central America and South America. Next one. And these are the deficit. If you add up the deficit GDP of countries that are disabled from the universal right to health, you see them here in proportional in this proportional graph, with India with almost 1/3 of the gap, and then followed by big countries like Pakistan, Ethiopia, the Democratic Republic of Congo, and others. Next one. Okay, this is the excess GDP, the graph representing the excess GDP in high-income countries, and how the life expectancy and national and subnational GDP per capita have evolved. So what you see there is the highest life expectancy in barcodes, which is now on average around 84 years. For instance, in Nara province in Japan, there's no higher life expectancy than that one. And you see the excess threshold and the subnational excess threshold. The excess threshold in terms of GDP, where you can see it in the right vertical axis, is in the region of 55,000. But the subnational one is around 22,000 GDP per capita. So above 22,000 GDP per capita, life expectancy does not improve any longer. What you need to do, if you have enough, is fiscal equity and being more efficient and more sustainable with your resources to render well-being. Next one. Okay, and this is the hoarding threshold over time. All of these we have in an equity atlas, health equity atlas, with interactive graphs and maps. But here we just see the snapshot of the last year, and this is where the hoarding, so to say, the countries living above the excess threshold with unnecessarily high resources for what they could achieve in terms of highest life expectancy. Next one. Basically North America, Europe, Australia, and Japan. And the excess GDP in those countries basically concentrated with almost 40% in the USA, and then followed by countries like Japan, Australia, France, Germany, etc. Next one, high-income countries. And this is the evolution of the three thresholds I've been talking about. the dignity threshold, which is now in the region of 4,000 GDP in constant value and around 14,000 GDP in purchasing power parity. And then you see there in orange the excess threshold and in gray the hoarding threshold. Next one. And I'm about to finish. This is where the hoarding countries are. Next one. And this is the hoarding of GDP basically now concentrated on the US. Next one, because of its economic size. And these are the equity zones. So in red, you see the countries that live with economic resources below what would enable them to enjoy the right to health and health equity. And you see in orange, those that live in the equity zone, so between dignity threshold and excess, and then excess is in gray and hoarding is in black. Next one. And the proportion of the population, which in fact now is around half the population lives in countries deprived in deficit zone, around 40% in countries in the equity zone, and then the rest is between the excess zone and the hoarding zone. Next one. And this is the GDP, which is inversely mainly concentrated. 60% of resources are in hoarding and excess GDP countries, some 30% in equity, and half the population only has like 5% of the global GDP. Next one. I'm about to finish, but I'm really eager to hear that. This is the impact of economic inequality. What I'm saying is not just a matter of economic mathematical injustice. It has a price in human lives. 90% of the countries that have excess mortality from the reference healthy replicable models are in countries with GDP per capita below the dignity threshold. And that is around from the 16 million is almost 13 million are of excess deaths because of global injustice are in those countries. So living above the excess threshold, as we will see also in a webinar to be in 2 months, which where we will analyze and estimate the negative impact of excess emission and excess hoarding, has a price in human lives. Next one. Okay, so, and this is the net burden of health inequity by equity zones. As you see, most are in the gray zone, in the deficit zone. Yet there are countries where they could have enough resources, yet they to have mortality rates below those reference models, and because of inefficiency, internal inequalities, etc., they still have a burden of health inequity, even in some high-income countries. Next one. Okay, and this is the proportions of years lost when we multiply deaths, excess mortality by life years lost. Next one. And this is the proportion of deaths which are in excess, which in deficit countries are almost 40%, almost 50% of all deaths are preventable, are in excess of what they could be. Next one. And this is the conclusion. Fair distribution of wealth is essential to achieve health equity. Economic policies should focus on reducing the hoarding of resources and ensure all countries reach the dignity threshold. I will leave it there, really eager to hear Tadhg, because I think his approach, probably with less number and graphs, but will show you the political frameworks that could allow this sustainability window he's been researching and publishing so much about. Thank you so much, Andre, for facilitating, and sorry if I went beyond my time.
Oh, thank you so much, Juan. I feel like you were on time. I think we are fine in time. It's always good to see you breaking your articles and showing us this data that is a living proof that, okay, the way that we measure and how we look at these inequalities and the global inequalities can be more illuminating for different paths of action. And I feel like your approach combined today, which is going to be here from Dr. Tadhg, is going to be very useful for us and for the next steps of SHEM this years and this coming months. You and I, when we ended up not doing a good whole service and we did not introduce Dr. Tadhg properly. So I would like to ask you, if you don't mind, Dr. Tadhg, to introduce yourself so the people in our audience who are not so aware of us can be mindful of your work and what you have been doing. And we truly apologize for this more informal way of running the webinars in which we somehow are not so mindful of the protocol. Actually, I should apologize for this because I'm the one who's the host. So you have the floor, and I'm sorry again for the inconvenience.
That's okay, no problem at all. Excuse me, I'm quite an informal kind of person myself, so that suits me just fine. If it's okay, what I'll do is I'll actually share my slides because I have the slide on explaining a little bit about who I am and what I do within there. So just one second. Okay, so thank you everybody for coming along today, and to Juan for inviting me, and to Andre for setting things up. Apologies to Faring. I think you felt you might be coming in on a private conversation. It was actually the first time I met Andre, so we were discussing a little bit about where we cross over, and I suppose some of the implications that come through. Um, my presentation is going to reflect on that. It's to talk about indicators and models are really important, but indicators and models always, to a degree, reduce. They're reductionist by definition. So they can hugely inform conversations, but if we're not aware of their limitations, they can send us in the wrong direction. So I want to focus a little bit on that as well as the sustainability window. Um, so from sustainable well-being to sustainability windows is the title of my presentation. To clarify who I am, I'm assistant professor in environmental policy in University College Dublin in Ireland, and I'm also adjunct professor in transformative futures at the Finland Futures Research Centre. So I focus on environmental policy, but I try and come back to fundamental concepts. I'm going to explain why I believe that's quite important at the moment. I also do analysis a little bit like Juan. I do modeling, and I do quantitative analysis in ecological and environmental economics. But I think it's really important that we strongly bring that back to understanding the complexity of the challenges in terms of well-being, in terms of systems change, in terms of the possible futures we can go towards. And also, I suppose, some of the limitations that are there in some of the models and indicators we have. GDP, of course, being a critical one, which does tell us a lot, but has specific limitations. And I think everyone in this call will probably be aware of that, in terms of that it can hide considerable sins in terms of a growing GDP is consistent with the world going into breakdown, both socially and environmentally, which is, I think, for most sensible people, is something we don't want to do. I have a PhD in energy emission scenarios, which is I use the scenarios approach. So a little bit like bringing those concepts and that quantification together, bringing together narratives that talk about surprise and dynamic changes, and also social culture, political change that underpins, because what we value, the practices we have, I would argue quite strongly determine the way everything plays out. That this is not technologically determined. It's fundamentally about our values, our perspectives, where we begin from, the legacies and institutions, inertia. And even interestingly, I noticed from Juan's talk, I think if you look at some of those examples, the first thing I thought of is post-colonialism, because any of those countries that are experiencing those difficulties are typically the ones that have that colonial legacy. And we're only beginning to have that conversation, I feel, globally, on the somewhat responsibilities of countries that have exploited over centuries, and the legacies of hampered and constrained development that have occurred from that, and real implications, and socially and particularly from that. I've worked across various different roles, which I think helps me to see kind of the research and analytical side, but maybe also the policy pathways side, because I've worked as a consultant. I've worked as in an institution in Ireland, the Climate Change Advisory Council, and their secretariat, to kind of produce the analysis that help to inform what they're doing, but also academic roles, lecturing, teaching, and mostly research, I suppose, is what I'm interested in. I try to bring system science in. I think it can be strongly said in terms of understanding sustainable development into the future means you need to understand the complexity, and it's thinking in systems allows us to do that. I'd strongly advocate for using foresight or future studies or la prospective, as they would call it in France, because I think it allows you to open up different pathways into the future and see different implications. I'll come back to that in a moment in terms of a bifurcation of two major paths. So there are innumerable paths into the future we can go, and each one of those will have different outcomes environmentally, socially, economically. And I try to apply this to environmental policy and put sustainable development fundamentally. And then that's applied to topics like energy mitigation policy. Well-being is the big thing I want to do, because I think we need to do a reframing, typically even the growth and post-growth debates we'll talk about. Well, let's move away from that. The thinking I would ascribe to more is growth is a characteristic of all peoples, of all humans, and of all physical, all biological systems. Growth and change are natural, but what kind of growth? So to reclaim that word is what I'm trying to do in my work, to say, okay, growth in society, growth in the flourishing of individual society and nature could be platformed as fundamental goals. I'll come back to that in a moment. I have had a little bit of success in kind of platforming that kind of conceptual approach. There is international interest now in Ireland, where we are applying to use that systems thinking to start with spatial planning and transport planning, not with carbon efficiency at the end, and how that can lead to transformation. So I did the work on that started the work in Ireland and was followed by things like the OECD report. There's international interest in that, and I think it maybe shows a little bit that while we're in a difficult space, there is ways forward, and I want to focus on that good news story. I'll come to that as well. And some of the things I worked on in recent years would be the assessment, the Irish Climate Change Assessment, which is analogous, the national analogy for the IPCC. I worked on the fourth volume on the benefits and opportunities of transformation, so specifically livelihoods, economic development, and governance and policy chapters. So what kind of livelihoods you can aim for, what kind of economic development can be there, even if it is a degrowth case in the economic sense, that it'll likely be that there'll be some sectors could be growing. You can prioritize ones that are high well-being. For example, my wife works in a hospital. Fund hospitals more. Make sure there's enough doctors, enough technical staff, and people can actually get care. Again, Juan pointed to the US example. It's the most expensive health system in the world, and its outcomes are really poor. So understanding that it's not just throwing necessarily investment or it's not really investment. It's not that the amount of money that's going into the system, because the system in the US creams that off for an economic elite at the top and is not prioritizing actual health outcomes. And then the governance and policy chapter is about how you enact and enable a systemic fundamental transformation. What I'll cover today is kind of decoupling, because I think it's a useful way to kind of simplify that complexity that I mentioned. So decoupling to achieve a sustainable future for all. My sustainable well-being work, which kind of maybe expands a little bit on where there's synergies, where there's positive aspects we can move towards. The sustainability window analysis from myself and my colleagues in Finland, and then some implications. So systems transformation for a sustainable future. What does that mean? The science is robust and clear. We must transform if we to address the unfolding climate and biodiversity breakdowns. This is currently occurring. The science is very clear on this. The public are often, because of misinformation and disinformation, are often not fully aware that there's no question on this. This is currently happening. It's accelerating, and it will get significantly worse if we don't change course. To change course, a really important conclusion of the IPCC and IPBES, which is International Platform on Biosphere and Ecosystem Services, is that you must use this transformation approach. So you work on systems and structures. So not even just thinking about finance and innovation or technology or renewable energy, that there's something much more fundamental from using a systems lens, that in considering different values and perspectives, different structures about how you can move forward, and what that will mean for people, and not just for something like a welfare measure or a GDP measure. but for people's well-being, people's life chances, and for the ability to actually reach a low emissions outcome and a restoration of nature. Which, of course, if we don't do, it can be platformed from an ethical perspective on its own. But also, if we don't do that, that completely undermines the basis for a stable human society and economy into the future. So again, common sense would suggest that you offset this risk and you must do this transformation. There are some signs, very, very small, but we're not really meeting this at all. And Juan's analysis shows that as well. You won't find countries with high well-being and low emissions, and that's not because it's a scientific axiom that it must be that way. It's because of the legacy of development and the legacy of choices and the legacy of repeating that. So the inertia, the lock-in that's built into systems that are high economic growth, that are unequal in terms of the outcomes, and a set of structures that are emissions and material intensive. That's been the legacy of the 20th century. We've not broken from that in only slight ways. For things with like such as renewable energy. So meeting these deep emissions reduction targets globally won't be possible with technology alone, at least not without significant economic and social costs. And I point this to people to recognize the value of modeling, but also the potential limitations. And it's this P4 scenario over here from IPCC 1.5 report. This is about, if you don't transform, what do you have to do? You essentially have to use the modeler's trick of bioenergy, carbon capture and storage. So you level nature, you remove lots of food supply, you cover the world in trees, you harvest those, burn them, and you bury the carbon dioxide. So the huge declines in food production, nature is gone. I don't think that's a future that anyone wants, but this is what a model that if the modelers did their job, because they needed to look at, if you continue on the current path and just rely on that kind of conventional technological approach, don't look at development, this is where we go. It's an abomination socially, abomination environmentally, and very, very risky, because carbon capture and storage has not been proven at scale, but it's the trick that modelers have to use to actually get us down to net zero, unless we do a fundamental transformation. So systems transformation, it's been there really since the IPCC third assessment report 2001. So it's in recognizing the global literature for quite some time to apply this development lens. So it's complex and it's systemic, it's holistic. It also applies to biodiversity and other environmental problems. It requires that you use inter and transdisciplinary methods. The social sciences are really important on this, because you need to understand the social, cultural, political, and institutional, the background legacies, and also the values that have been applied in the last couple of hundred years or 250 years since the Industrial Revolution, and that are being applied into the future. That this is a future right now that will be owned by economic elites and not even by the majority in the global north, let alone the global south. That you are removing people's life opportunities directly by this pathway we're on. But also the kind of ethical issues of equity and justice, which are fundamental to a social contract to address these issues, but also, of course, as outcomes, that equity and justice are important to all of us. And you can even see that, of course, in psychological definitions of what fairness is, that's innate and it's there from without even being learned by human beings. It's there innate in us. So these issues are important to the global north. It's not just the global south, because of course that needs to come into the conversation. But the global north, you have growing in-country inequality. For example, in the US, in the lower income deciles, you see no increase in income for 5 decades. So life is getting harder for people in the US. So even though you see that large GDP dominating globally, it's just an economic elite at the top that are creaming that off. And that's really, really problematic. It's been pointed to by people like Piketty, the International Panel on Social Progress, Peter Turchin, some work I came across recently. He works on cliodynamics, and how this big arc of history is played out after when we had the Green New Deal. as a recovery in the last century that did actually achieve more equality of outcomes. It's very, very clear in the income inequality data that you will find. And we've had 5 decades now of neoliberalism that spread from Margaret Thatcher and Ronald Reagan, and then went through various different global institutions to become the central political approach. So market first, and all other priorities deprioritized. And we have this now in growing inequality, the US being further down this road, and it's really problematic. It also shows up in consumption. Overconsumption is the mega driver of global environmental change, particularly if you pick those two priorities, climate and biodiversity. And this was really good in the IPCC fifth assessment report. Luxuries in the global north are consumed at the price of the basic needs in the global south. So that's the ethical issue again that Juan was pointing towards. This is indefensible from an ethical standpoint, that you can have people consuming a phone every 6 months, and people in those countries with these development lags that are frequently supplying a lot of resources to actually get us to these consumer products, it can't meet a set of basic needs. And this is where I suppose the floor perspective becomes very useful from an ethical standpoint, that as Juan has used. The problem of overconsumption is really strongly there. So I have no problem with high income spread around, because it's somewhat abstract. It's somewhat, in some ways, it can be somewhat irrelevant. In terms of the environment, it's the overconsumption. So and even in terms of people, it's the consumption of resources. So are you getting good health care? Are you over-consuming energy, material resources, so that the world goes further towards breakdown and over that cliff in the next few decades? That to me is a critical question. That income gives a partial analysis, but the consumption lens gives a different and I think more fundamental in a way. So overconsumption, how can be defined? And I hear this question asked sometimes. I would say it can be defined in a number of different ways. If you talk about environmental systems, it's very easy to start picking on where there are points here in terms of environmental systems, be they local or global, and applying things such as planetary boundaries. Excessive pressures is where you define overconsumption. You can also define it in other ways that typically don't come up in individual human well-being. Our diet, if we overconsume protein, if we overconsume ultra-processed foods, if we overconsume calories, how bad is that for us? And how bad is that for the life expectancy that Juan mentioned earlier, as well as healthy life years that we actually have, that long lifespan is actually something that can be enjoyed, and it's not spent with decades of poor health. There's also, too much technology, which takes us away from important things in well-being, such as being buried in your phone, or prioritizing that you have what would be called Veblen goods, so the status consumption, so like expensive cars at the expense of connecting with your community, your family, your friends, and your partner. And then addictions as well, and that's the physical addictions, and also things like gambling, drugs, cigarettes, tobacco, alcohol, and the illegal drugs. These are all problematic. So you could be consistent that you have a high income, but you have all of these costs, and you can see this in multiple countries when you start to interrogate a little bit more what's going on. It can also be determined from consumption that occurs at the expense of others, including future generations. This is an ethical or anthropocentric view that there is no absolute freedom. And this is where this term freedom gets bandied about and abused and manipulated. Freedom is always in relation to others. So if I consume extreme amounts, that comes at the cost of others. The latter can be linked to consumption that leads to destruction of ecosystems and species, so the ethical ecocentric viewpoint. And that's not just a north-south problem, in that consumerist identity is there strongly for the last few decades. It's also in elites that have emerged in the global south. But with those awareness of those key problems, I'd say to have that kind of difficult or uncomfortable conversation about these aspects, this is what I would argue allows us to actually start to articulate key solutions. So decoupling was identified in the Intergovernmental Panel on Climate Change report, the fifth assessment report, two main forms. So decouple, the one we would typically be aware of, decoupling materials and energy from an economic growth. That's technological change and efficiency. Necessary but not sufficient to get a transformation to get low emissions and biodiversity restoration. The other form is to decouple human well-being from economic growth and consumption. This is characterized by the IPCC as the stronger form, although sometimes a bit more controversial because you're getting into defining what well-being is. But I would say if we don't define what it is, it gets defined by whatever culture or power or privilege is out there at the moment, which is, yeah. Sorry?
No, sorry.
Yeah, okay. It gets defined by whatever culture or power or privilege that's out there at the moment, which is a high consumerist idea, which is doing damage to us. So I'd say that it's environmentally and socially, I'd say it's something we do actually need to engage in. So there is a beginning of change to move away from this technological change focus only in terms of sustainability, in terms of greenhouse gas emissions and biodiversity. Degrowth and post-growth scenario teams will be found now in the literature, and in the sixth assessment report became part of the mainstream. And this can widen the solution set by doing this, and I would say make the model analysis we use more robust. Well-being and equity are critical themes within to actually understand how this decoupling approach could occur in terms of human well-being. To briefly go through what does this mean? Running through from conceptualization to a new design of goals and an implementation of policies. The key bit I'd point to is at the top, talking about well-being, inter and intragenerational equity, and the procedural equity that you actually consult people, that you then consider human development and environmental conservation or environmental policies through those two major modes, the conventional mode of climate policy, but also development policy. What are we actually trying to do in the first place in terms of our economic and physical development? And that working on both of these can push you towards a sustainable development path. So using development and conventional policy tools, technology and environmental, the tools from environmental economics, bringing those together leads to widening the scope of solutions and maximizing the benefits. This is a slide I sometimes like to use from the sixth assessment report to describe that kind of bifurcation that I mentioned earlier. If you continue to evolve on the current system, you're in entrenched systems with high emissions outcomes that's really expensive to then bring down those emissions, and there are limits to what you can do in terms of adaptation. So this is lose, lose, lose. If you go to the transformative approach in a sustainable development pathway, low emissions, the systems transitions and transformations, you're inherently lowering climate risk, you're including equity and justice, and you have higher SDG achievement. So that would effectively be improvements in well-being across all peoples. My paper on sustainable, or my article on sustainable well-being, tried to place this centrally, well-being, equity, and nature as critical to understanding mitigation into the future, as values that fundamentally lie that all that is important to us, and as fundamental goals for development. So this was the first transdisciplinary integration globally to bring together economic, psychological, and physical wellness concepts of well-being that's published in the literature to integrate that with sustainability science. Some of the findings, well-being literature typically ignores nature and environment. You look at any of those major well-being concepts and frameworks, nature and environment is left out. That's problematic. It's divorcing us from something that's really important to our well-being and an artificial separation. Sustainability typically doesn't define what well-being or needs are at all, and that's also equally problematic. The terms are bandied about but not actually interrogated. These are complex and value-laden concepts in terms of values and ethics. I pointed towards the importance of objective lists that you can identify key dimensions that are important. talked about the reframing of growth and change, the importance of social justice, the ethics of freedom still becomes important, and balancing that across people and and the value of nature. And emphasizing that an integrated sustainable well-being then offers and platform that at the conceptual stage offers the potential for win-win outcomes. This is the really good news story that we don't actually get because we're not really asking these questions enough. And in that paper, I discussed operationalization and implementation. A bit of a whistle-stop tour, but to get to sustainability will-know analysis, it's an analytical approach that allows you to ask crucial questions of sustainable development by bringing together different variables that can map social culture or social, economic, and environmental change, and so in multiple dimensions. In the sustainability will-know analysis, it's in parallel in some ways to what Juan has done, that you're setting a maximum economic growth in terms of trying to avoid negative change in an environmental condition for any selected environmental indicator. That again must be politically defined. It has an ethical and value dimension. And then the minimum economic growth in terms of what could be associated with positive social development for a selected social indicator. And that this minimum and maximum level gives you the sustainability window, that your development should be within those, preserving the environment and not going below a level that pushes people into poverty and immiseration. The approach describes a general platform for building sustainability science, and it can interrogate, for example, the UN Sustainable Development Goals. It's applicable to many different questions. The theoretical approach can look at that economic growth, degrowth debate. So this is what we did in our 2024 paper, looked at all theoretically possible scenario paths for development in growth and degrowth, combining these outcomes with economic, environmental, and social dimensions, and with the environmental and social productivities of GDP. And interesting, what I've found from looking across all possible outcomes, there were only 4 logically possible scenario paths that could be considered theoretically sustainable. 2 cases of economic growth and 2 cases of degrowth. Now, recognizing that this is theoretical. In the case of each of those 4 paths, sustainability only emerges where they adhere to very strict conditions. So if it's a growth path, it must be respecting the environmental limits. And if it's a degrowth path, it must be preserving the social outcomes, or vice versa, because it actually both of those conditions apply in both cases, as well as related productivities. So to give you an idea of what this comes to, there's many different figures in this paper, but to give you an idea of where this window would be, the sustainability window is that GDP max and GDP minimum, where it is justified by that environmental limit and that social floor. And as I said, this can be applied to any region, any nation, any city, and to any environmental problem or any social indicator, as long as it's an absolute indicator. So it allows it's another means of achieving the kind of analysis that Juan showed later. So to go quickly to conclusions and not keep you too long, the transformation of development paths across system scales and structures, this is now accepted as necessary. This is really, really critical, because we've had this interpretation that we can rely on market-first approaches and policy reform with technological change and then environmental economic methods such as carbon pricing to incentivize change, that this would do it for us. The literature is very clear now. We must go to a transformative approach of systems, and we must think about enablers, and equity is actually an enabler because it preserves the social contract and actually prepares people for the change that needs to occur. We can't continue down the path we're on. When this concept underwent exponential growth in the literature, but it's now mainstreamed, but not in public debate, I would say quite strongly, nor in public policy or most national analyses. So there are big knowledge deficits. We know that this needs to be applied. We know broadly what it might mean, but in context, little is known about it because we've concentrated on the technological transition approach. The good news story that I think is really important to take home is there's significant opportunities for synergies across multiple priorities. So better well-being, addressing equity and poverty, reducing environmental pressures, restoring nature, getting to low emissions outcomes. These are all possible from a transformative approach, a transformative change approach. But we will need new policy and new analysis to inform new policy to address these significant deficits. The sustainability wind analysis offers one such approach, as it can function as a comprehensive theoretical and analytical framework of these complex challenges of sustainability. And the 2024 paper outlines how both economic growth and degrowth can theoretically be sustainable, but this is, of course, only theoretically, but then would have to be it would then have to be enacted under those strict conditions that, for example, you are reaching net zero or zero greenhouse gas emissions, zero CO2 emissions, and you're preserving that social floor. So there's scope for development for all peoples, and it can be further applied to other questions. Lastly, an important caution I would put in is the limitations of indicators. Again, that there are empirical limitations to indicators, there are policy limitations to indicators. The myth of what we measure, what we manage. You need wise management, not management that maximizes, say, efficiency. You need to look at the outcome, and also ethical limitations, because it always leaves things off. And indicator movements themselves, I would also caution, it can be really, really useful, but if we focus on the indicator movement rather than are we substantially changing policy and reconceptualizing to move towards a transformation, then that we are quantifying where we are, but not enabling change in where we are going. So apologies if I may have gone over slightly. There's some links here if you want to check any of these papers. Thank you so much for your time. And maybe if I pass back to Andre and Juan.
I would ask you to stop sharing, Dr. Tadhg. Thank you so much. So informative to see how actually there's so much going on the, at least on the conversations in the academics about, okay, it's not working. We need to model and think another time. And I feel like SHEM as a movement tries to bridge this space through advocacy. And I feel like your lecture, particularly for me who studies social movements and protests as a psychologist, is very illuminating because, okay, there's path of action that we can and we should be engaging. I wonder if one would like to make some comments. We are a little over then, but I think we might make some comments and even ask if the audience has any concern question.
Yeah.
One.
Well, very briefly, because I would like to also listen to colleagues. The thing is, this has been really nice. I'll be very honest with you. Tadhg is one of the best, if you've really rushed through the presentations I've seen lately, I've heard lately. I'm really grateful because, as you said, we said very simplistic terms of, if historical records tell us that if you go beyond this threshold, you're not improving your well-being. Looking at the simplistic correlation of life expectancy at birth, which is strongly correlated with most well-being on statistical terms, well-being dimensions, and yet again below this level, no country has proven that can enable the access to knowledge and basic dignified conditions for that best feasible level of health, which is the only global health objective for all countries. The thing is, and I think it was fantastic to hear your analysis of the dynamics required to redirect development and economics to the sustainability window through the growth in many cases, through certain levels of growth in others, and of course adjusted to each country and context. The problem isn't it, that we are living in a world that seems to be in the right opposite direction, and the recent events seem to tell us from the US seem to underline the fact that growth and drill baby drill and things that are ethically how can I say, insulting to any human intelligence and any basic level of ethics. I think we are worse off than what Plato was saying 2,400 years ago. Some people say that the Human Rights Charter wouldn't be agreed today by the world powers. So what do we do? And so the mainly, I'll be again simplistic, there are mainly two ways of changing things. One is political masters and economic leaders, and those, let's say, in the policy making, hear the evidence, um, sense the threat of the pathway we're following, and bring about some change. I must say I'm very doubtful that can happen. I've been for the last 22 years in the European Commission. I've talked with governments all over, and you see how all of a sudden political changes can go for the worse. It would be wonderful to see a leader changing everything for the better, but doesn't look likely. And the problem is the probabilities are low and the time is so limited. They say this year is the first one we have trespassed the last year, 2024, the 1.5 degree seen by many scientists as the point of no return. If that is maintained a few years, that probably will lead us to a scenario that we don't even know the consequences yet. So the other pathway, so if time is limited, political um, uh, choices seem to not meet the ambition required. How can people change? How can people twist the system? How can people even ignore the system or resist the system? How can we get away from the growth trap, or from the excess dynamics? And I wanted you to tell us something, Tadhg, on what, as I told you, I heard that it, for instance, is beginning to happen in Finland, one of the countries with highest Human Development Index, an index that we will challenge in a coming webinar, because again, it's based on GDP, no limit GDP. But it is a country where apparently they're beginning sociologically to identify some, how do they call it, wealth aversion, so luxury aversion, where normal people in the talks, in the whereabouts, in the way they behave in society, luxury is seen as something questionable. And those things probably, again, too slowly, but may begin to happen. And my main bet is that the youth in this world will be well aware that above certain level of emissions, we are doomed to disaster. And it's really their future more than ours. And they will begin to challenge strongly everything that does not respect carbon emissions ethical thresholds. And if you respect carbon emissions ethical thresholds, you necessarily need to live on local production and consumption, at least on 20% of your GDP. And that automatically reduces, almost abolishes any excess GDP. If we really, we would need to probably diminish our global trade by 4, because a large share of the global trade is on those luxury items and contingency services and items. You can very well live without them and yet preserve your levels of well-being. So despite the time we because this is recorded, and I tell you that many people will discuss it later. But what are your views on how you gave all the evidence of the path towards sustainability window, but where do you think civil society, the conscience of young people or certain societies in the world, can begin to challenge and divert what the main economic and political forces seem to be driving us all?
Yeah, I think the model that's used in terms of governance, in terms of understanding state, market, and society is a critical one. I don't think we can make these changes without all three. If it's solely the bottom-up movements are critical, but if we solely rely on those, you have big structures in terms of state and society that are preventing the change in systems. Market can be a positive force for change, although most of the time ESG and CSR it's greenwashing and whitewashing, but you will find companies that are doing substantial things or parts of their activities that are doing substantial things, and it's social, culture, and political conditions that will see which direction that goes. And in terms of governance, I would say it is hard to see it at the moment, but there's been many times in history we decided to go, okay, there's countries that chose universal healthcare or put in a welfare system, or even it's maybe not maybe the nicest an analogy, but to decide to go on a war footing and completely turn your economy over. That these big changes do happen. We were probably in a better condition after the Second World War, as in Keynesian economics, there was an appetite to intervene. We've now had five decades of a failed experiment to say, well, we'll have small government and low intervention and low regulation. And it's not working. So I'd say it in its strength and that that's taken over is its weakness, that it mightn't be that far away that it actually collapses because it's not going to deliver. You know, the new president is not going to deliver. I would be surprised if people are not disenchanted within 2 years. I'd say it'll be quicker than that because he's offering non-solutions. He said, drill, baby, drill and go for coal. You know, renewable energy is cheaper in most contexts. So this is like it's like trying to fight the ocean back. You can't some of this you can't put back in the box. One thing I'd like to point from futures thinking that I do like to come back at, there's always the seeds of these change. In terms of futures thinking, what they say, we overestimate change in the short term, but underestimate in the long term. We could have this conversation again in 10 or 15 or 20 years, Juan, and we could be in a very different world. Even thinking of the changes we've had in the last, that even Donald Trump could come about, that you'd have the COVID pandemic, that you'd have the global financial crisis, any of these kind of surprise events. Things can and do change. And I think we need to retain that hope and empower society and keep the activism and celebrate the companies that do push forward, but really understand for me that the state is going to be critical in this, in helping to curtail the excesses, essentially.
Mhm. Fine. And my last question, Tag, before we come to a close, if unless Andre has something else to add, which countries do you think could be at the forefront of this change, can show a path of well-being in respect of nature and coming generations, and as you say, as states can challenge what the main leading powers seem to be doing?
I mean, there's many initiatives, you know, the Juan Garay and reforestation in Africa, or the reforestation program in China. Spain has a really good health system and quite a good welfare system. So there's many different examples there. There's one example that I will push you towards. I had a mini conference here in Ireland yesterday when I invited over a person called Jane Davidson, who started the Welsh Future Generations Act and the Welsh Future Generations Commissioner. That's now being used as the model for UN 2.0. So that's to recognize that we need transformation, and to do that we need to use foresight methods that look across the dimensions and enable this transformation. So she calls it lessons from a small country, and it's really quite nice that it's presented quite well, but it's substantial in where it comes from, and the pathways that she puts through on implementation that are being described are achieving. So I think a lot of it will come from smaller countries. I think a lot of it will come from marginalized peoples. A lot of it will come from probably from wasn't it the Dalai Lama said the Western woman. It'll need to be a lot of people coming together, crossing over and understanding where these things do cross over, and you need alliances across these for gender, for equity, for environment, for biodiversity. And again, to point to the positive, they are there. Those examples are there.
Fantastic. Well, thanks so much. We really count on you in the sustainable health equity movement. We will keep you informed. Your paper has been featuring in the last highlights, and it's really an honor to to be connected with your brave and thoughtful analysis and based on ethical principles. It's really something we encourage you, and we're really glad and happy to be connected.
Delighted to be contact, Juan. Thanks so much.
Thanks so much. Andre, yours is the floor to probably close this
Thank
session.
Thank you so much. It's so good to hear both of you bringing this conversation to the forefront. I'm in Canada right now. It has been for me unprecedented to see the tariff war and the effects here, and how somehow we live in a moment in which, okay, we need to somehow connect to possible futures and make them happen. And see you talking about for us side as an important cover methodology on this makes me very glad that okay, there's possibilities here, and I feel like it's time for hope and for action. And we are really glad of having you as part of the series. This will be recording, gonna be on the website, and we look forward to keep exploring other paths of collaborations. I feel like there's events that we're gonna be promoting, and would like to have you and your network of people who can reach out. And please feel free if you feel like there's something we can do as a growing movement to somehow enhance your efforts. It will be your pleasure and honor. It's good to see that we have good allies and good comrades in this necessary fight. Thank you so much.
Thank
Thanks
you
so
so
much,
much, Andre.
Andre.
Thank you.
Okay.
Thank you so
I will
much,
stop
Tad.
the recording now, and I look forward to see you on the coming events on this series. Bye bye, everyone.
Bye.
Thank
Bye-bye.
you.